Hello, good afternoon, my dear students. I am Malik Farooq, lecturer Zoology BHSS Langate, and the topic I have chosen for class 12 it is difference between infectious and non-infectious diseases. Infectious, the second name, communicable diseases. Functional or non-infectious diseases are non-communicable diseases. The first difference is that infectious they are caused by the parasitic living organisms or pathogens, while as they are caused by the agents other than the living organisms. Number second, the diseases are passed from infected person to healthy persons, while as in case of non-infectious disease, the disease cannot pass from one person to another. A direct or indirect transmission is involved in case of infectious disease. In case of non-infectious disease, transmission is absent except for the congenital diseases. The diseases are due to extraneous factors, while in case of non-infectious, both extrinsic and intrinsic factors are the cause of disease. Point number 5, public health and domestic hygiene can reduce the incidence in case of infectious disease. If there is an infectious disease, public health and domestic hygiene. Once we keep the hygiene, we keep the environmental, we keep the surroundings clean, our vicinity clean, there are least chances for infection of a disease. So in case of non-infectious disease, public health and hygiene are ineffective. However, counseling can be useful. Then there is another point, common infections are communicable diseases in humans. Infectious disease agents are a wide range of organisms, for example, bacteria, viruses, protozoans, fungi, helminthes, etc. They belong to the category of parasites. Para means others, cytos means food. Parasites are those organisms that derive their nourishment from other living organisms called hosts. They live inside or outside the body of their hosts for a part or whole of their life. All parasites harm their hosts to a small or large extent. Number 1, by interfering with the normal functioning of the host, or robbing the host of its nutrients, tissue damage, release of toxins, exotoxins, for example, diphtheria, or endotoxins, for example, cholera, typhoid. Pathogens are disease-causing organisms or parasites. They have a specific point of entry into the body, for example, called a portal of entry, for example, nose, mouth, skin. And after gaining entry, a pathogen will multiply and would start interfering with the normal vital activities of the body, resulting in the morphological and physiological damage. So for entry into the body, multiplication and obtaining nourishment from the host, pathogens have several adaptations. For example, pathogens of gastrointestinal tract must be able to survive lysozyme, acidic pH of stomach, hydrolytic activity of various digestive enzymes, and anaerobiasis. Then there are modes of transmission. Direct transmission, indirect transmission. Direct transmission में हमें आता है direct contact. It occurs in contagious disease. For example, ringworms, droplets, sneezing, spitting, coughing, and even talking produce a pathogen carrying mist from nose, lungs, and mouth. Common cold, influenza, diphtheria, soil, tetanus, animal bite, rabies, transparental transmission, German measles, syphilis. इस तरह indirect transmission, vector, an animal transfers from pathogen while visiting the host, for example, mosquito, sandfly, housefly, vehicle, food and water carry pathogens, for example, typhoid, airborne, dust and air current, typhus, fomitis, articles coming in contact with the patient, door, handles, tap, currency, garments, unclean hands, they transfer pathogens to food, termites, food utensils, and other persons. Then we will start the various these diseases, types of disease, for example, enteric fever and typhoid, pneumonia, and these we will discuss in the next lecture. Thank you for watching.